Active Breathing Coordinator, ABC device for breast cancer. This video will explain why and how an Active Breathing Coordinator device or ABC device may be used during your radiation treatment for breast cancer. In this video, you will learn why you may need the ABC device, what an ABC device is, and how the ABC device is used. At the end of this video, you will hear a patient talk about their experience using the ABC device. Why you may need the ABC device. As part of your treatment for breast cancer, you will be getting radiation therapy. Watch this animation to see what happens inside the body with and without the ABC device. Without the ABC device. For some patients, the heart may be exposed to radiation because of how close the heart is to the tumor in the breast. One way to reduce the amount of radiation to the heart is to shift it away from the breast using the ABC device. With the ABC device, this animation will show how taking a deep breath expands your lungs and moves your heart slightly away from the area being treated. The ABC device helps you hold a deep breath for a short period of time. This reduces the amount of radiation to the heart. Many people are fine using the ABC device, but some people may be nervous about using it. This video is meant to help ease any fears you may have about using the ABC device. What the ABC device is. The ABC device consists of a nose clip, mouthpiece and tubing, a green button, and a computer. The tubing connects to a device at the top of the table. This device has a valve that closes and stops airflow through the tubing. The valve is released either by the patient letting go of the button, the therapist manually releasing the device, the ABC device releasing when the breath hold is completed. The nose clip is put on your nose to help you breathe only from your mouth. The mouthpiece is put inside the mouth. The mouthpiece has notches to bite down on to keep it secure. The mouthpiece works like a snorkel. You will need to keep a tight seal with your lips around the mouthpiece as you breathe in and out. The green button is used to let your therapist know you are ready to hold your breath. When you let go of the green button, your therapist knows you need to take a breath. The computer is used to measure and record how much air you breathe in and for how long. How is the ABC device used? To use the ABC device, you will need to be able to hold your breath for 15 seconds or more, breathe through your mouth when the nose clip is on your nose, follow the breathing instructions, and keep a tight seal around the mouthpiece. During your radiation planning appointment, your radiation therapist will coach you on how to breathe while using the ABC device. You will get a chance to practice taking a few deep breaths. Once you have practiced, your therapist will enter the settings into the computer. The settings are based on how deeply you breathe and how long you can hold your breath. If you can hold your breath long enough, you will get your CT scan using the ABC device. Your therapist will ask you to take a deep breath and press and hold the green button. When you press the green button, the ABC device will help you hold your breath and your team will start the CT scan. Once you have reached the set amount of time you can hold your breath, the ABC device will release and your team will stop the CT scanner. You can now breathe like normal. You will use the ABC device in the same way during your radiation treatment appointment. If at any time during your radiation treatment you need to breathe, let go of the green button. The breath hold will be released and the radiation will be paused. In some cases, the ABC device may not be needed if your heart is far enough away from the area being treated. If you are unable to use the ABC device, your CT scan and planning information will be used to make sure your radiation treatment is delivered safely. Here are some final things to remember. To prepare for using the ABC device, practice taking slow, long, deep breaths at home before your CT scan and treatment. This may make it easier to use the device. While you are getting treatment, your radiation therapist will coach you through each breath hold. you are in control of when you can breathe. Watch this video as often as you would like to become more comfortable with the ABC device. If you have any questions, please ask your radiation therapist or your radiation oncologist. For more information and helpful resources, read the pamphlet, Know about the Active Breathing Coordinator ABC device. You can find the pamphlet at the Patient and Family Library located at the Princess Margaret Cancer Center, online, or by asking your healthcare team. Next, you will hear a patient testimonial.
My experience with the ABC device, the snorkel as I call it, the radiation therapist took me through it and was very clear with what I had to do, and there was plenty of practice before I actually got to the real radiation time. And even I didn't feel stressed when I was getting the radiation, because you can just release the button if you need to breathe and the machine will stop, so there's nothing to worry about.
In this video, you have learned why you may need the ABC device, what an ABC device is, and how the ABC device is used.